Hi, everyone. Welcome back to Wondermind's first Mental Fitness Summit. I'm Casey Gueren, and I'll be moderating the Therapy 101 panel featuring some amazing experts from the Wondermind Advisory Committee. So, we're going to be talking about how to start therapy, what to expect, how to make the most of it. And if you have any other questions as you're watching this, feel free to put them in the question box, and we'll try to get to a few at the end of the panel. So I'm thrilled to be joined by our experts. We have board certified psychiatrist, Dr. Juan Romero Gaddi, and we have licensed clinical psychologist, Dr. Jessica Stern. Hey guys, happy World Mental Health Day.
It's great to be here.
Thank you so much for having us.
I'm so excited to dive in. Let's get started. So let's get started with where to start even. So what would you say to someone who has no idea where to start looking for a therapist and really has no idea what this might cost to? Dr. Stern, we can start with you.
Sure. So I think this is one of the most daunting pieces of seeking out therapy. And the tough answer is that there isn't one specific place to get started, and sometimes it can be difficult to navigate the different avenues and registries and all of these types of things. But the good news is that there are a lot of different opportunities. And so you can check certain directories like Psychology Today or Zen Care or a whole host of other ones. Alma is another really great one. So directories, I think, are a fantastic place. Also, organizations around specific areas related to different specialties of mental health, whether that's CHAD for ADHD or something like ABCT, which is the Association for Behavioral and Cognitive Therapies. Essentially, organizations around specific areas of psychology, mental health, and psychotherapy. You can tend to find registries there. You can also locate different options at medical centers near you and sort of just canvas what's available both in your physical proximity as well as the areas that relate to you as a human. I'd say one last quick tip is also to check different organizations that are nonprofits related to a particular identity that you might have. So for a great example, Therapy for Black Girls is an awesome one to check out. So finding different ways in which you might connect to a specific community or identity might have an organization or a nonprofit that you can canvas as well.
That's great. That's so helpful. Dr. Gaddi, what would you add to that? If you're looking and you really just don't know what to expect, how long this is going to take, what it's going to cost you, what do you typically tell people who are starting the search?
Yeah, I think that if you are looking to start therapy, one of the biggest questions is like if you're going to use insurance or not, because that can be a huge variable of what is available to you. If you have an insurance, a healthcare insurance, definitely use the directory, give them a call or go to the website, make sure that you include your ID, group number, and all that information so you know what you're getting. And then you can get all the information about if you have a copay, if you have a deductible, like co-insurance and all that. Now, if you don't have an insurance, I do think that talking to organization is really important. And you can also ask about sliding scales. You can also ask for providers that they work with insurance, but it's really important to, from the first call, to ask how much will be the out-of-pocket cost, and tell them that if you're paying out of pocket, if you have any discount, because you will be surprised if they can give you a significant discount if you're paying out of pocket.
Right. And that's something that I think a lot of people run into for the first time when they're looking for mental health care versus physical health care is not everyone takes insurance. This might be a stupid question, but why is that?
I think that there's a lot of reasons for that. But one of the biggest things is that if you're working with an insurance, it's a really long process to get into the panel and getting network with insurance. So not a lot of providers have the resources or the time to do that. And that can also elevate the cost for those that are going to see you and going to pay out of pocket, if that makes sense. And I also think that working with insurance have pros and cons, but one of the biggest concerns is that sometimes privacy can be an issue. Sometimes part of the process is that you have to give the patient or the client a diagnosis. And I understand when some mental health providers try, avoid doing that for privacy reasons.
Yeah, that makes sense. Even though it's so frustrating, right? Sometimes when it's just like another hurdle sometimes. And now I think another thing that people get confused about when they're looking for a therapist is all the letters behind people's names. We've got the two of you have different letters after your names, different credentials. There's LMFT, LCSW, PhD, MD. What should people know about those? And how do you really know what would be the right type of therapist for your situation?
Excellent question. I think this is probably one of the more common questions we get. And I can understand why this is just so challenging because the alphabet soup of it all is just very confusing. What the different letters connote are different ways in which individuals were trained and perhaps even the different specialties or certifications that they might have. So PhD and PsyD tend to be clinical and counseling psychologists. MDs and DOs tend to be psychiatrists. We also have clinical social workers, which have all sorts of different levels as well as MFTs, which are marriage and family therapists. The thing that you want to think about is what do you need and where do you want to start from there? But the good news is that even if you're not totally sure, what can oftentimes happen is if you seek out a referral with one of these providers, hopefully if they are not the right provider, they will be able to direct you to the right appropriate care. What I will say is that psychiatrists tend to be the only ones who can prescribe medication. So that's something to note. Sometimes you also might be able to get mental health medications from your primary care doctor as well. In terms of psychologists like myself, we tend to do mostly therapy, as well as other types of therapists as well, like clinical social workers and marriage and family counselors and things of this nature. So it can be tricky. And I think that's one of the hardest parts is to navigate that. But what I would say is if you really feel daunted and you feel like you're in this sort of hamster wheel of trying to figure out who is the right person, is find someone that has the particular specialty that you need, regardless of the letters behind their name. And you can ask them, are you the right person for me and for my treatment needs?
Yeah, that's so helpful. Dr. Gaddi, anything to add there? I know you're a bit of a unicorn in this space that you do combined therapy as well
Yeah.
as psychiatry.
Yeah, so I think that I will with psychiatry. Most of the psychiatrists they do medication management, but some of us they also do therapy, and that give you the opportunity to see somebody that maybe you can do therapy, but also get your medications from them. However, it's not really common, but there are a few of us that actually do that.
That's awesome. That's got to make it a lot easier if that is something that you're looking for. So it's good to know that that is sometimes an option. So another question I feel like that a lot of people have when they're getting started in this is just kind of when to even start looking. So most of us tend to only really think about this when we're already in crisis, but ballpark, on average, how long should people anticipate this process taking to look for and get seen by a new therapist?
I can get started
Yeah.
here. So I think as soon as you start to ask yourself, should I be looking for a therapist? That is the appropriate time for you to start looking for a therapist because that typically means that you are ready or approaching ready. And that curiosity tends to connote or suggest that you're looking for something. I think what we always say is that there is no wrong time for therapy. There is always a right time for therapy. You don't need to wait for something to be broken or too problematic or too far gone. Really, therapy, and I think this is one of the greatest values that Wondermind tries to really instill in people, is that it's an opportunity for you to continue skills and to just practice working on your mental health regardless of where you are. You might feel like you're pretty well off mentally, but you want a few additional skills and only need a short span of therapeutic sessions, or you might be in a state of crisis and need something more intensive and longer term. All of that is acceptable, but the short answer I would say is the moment you start asking your question, am I ready for therapy? Should I start looking? That's your moment.
Yeah, that makes a lot of sense. And also just reminds people to maybe start looking before they really need to. But yeah, I mean, what does the process typically look like? I mean, you're searching for people, but let's say you find someone that you think might be a fit. What does that next step even really look like? Are you just kind of booking the appointment? Are you asking for a phone consultation? What does that look like?
Yeah, I think that it depends. I think that definitely you can read some bios online and that will give you some idea if this is the right fit. But it's really important to know that the right fit and the relationship that you have with your therapist is the best predictor for success in therapy. So it may take a little while. And if you need to see a few providers until you decide it's completely okay, I know that it can be a little bit frustrated, but also give it some time because sometimes the first sessions can be a little bit different. It can feel more like a questionnaire or a checklist because as a provider, we need certain information for documentation, for insurance, and all that. So it may take a few sessions to build that rapport, that relationship with the therapist or your provider.
Okay, good to know. Yes. So let's get into kind of what to expect then when you found someone, you've gotten an appointment, you have now won the therapy lottery, and you're getting started. What would you tell people to expect kind of the first few sessions? Can you kind of just dive right into the problem that you're having, or should you be prepared with like a PowerPoint of all your traumas? Dr. Stern, we'll start with you.
So like Dr. Gaddi actually just mentioned, the beginning is really the opportunity for you and your therapist to get to know each other. And so what you can expect is that your new therapist is going to spend some time getting to know you. Different therapists have different styles. Sometimes they go with more structured interviews. Sometimes it's a little bit go with the flow. It depends on the style of the therapist, their training, and the ways in which they approach this relationship. But you can typically expect that the first session is going to be a little bit more of, let me hear a little bit about what brings you here, what you're looking for, your history, your mental health history, perhaps even a little bit about your family, your upbringing, your culture. So it really starts off by getting to know each other and sort of setting the foundation and creating some sense of context. From there, it might depend a little bit, again, on the therapist and the style in which they practice. There are many different styles in which therapists practice. What I will say is many therapists will also ask you, do you have any goals for therapy? Is there anything in particular you want to achieve? Is there something specific that you're looking for? And I would say if you have an answer to that, that's fantastic. But if you don't, that's totally okay. Because what you can actually do with your therapist is say, I'm not entirely sure where I want to go or what exactly it is that I'm looking for, but this is how I'm struggling in XYZ way. Can you help me figure out what might be an appropriate roadmap? So being able to clue in your new therapist to a little bit of what is going on in your current space and to the history of that problem is going to be very helpful information at the beginning. And then from there, you'll start to figure out how you want to approach those skills and those goals that you have.
Got it. Okay. Dr. Gaddi, anything else to add around like what people should be prepared to talk about maybe in those first few sessions, or how to get a little bit more comfortable with that process if this is totally new to them?
Yeah, the first thing that I will say is be honest and be yourself. At the same time, keep in mind that you're going to feel anxious, you're going to feel nervous. It's completely normal. Picture the whole situation. You're going to a completely new space. You're meeting with a person that probably is a stranger, and you're going to probably be talking about a lot of like a stressful things. So that sounds really scary. So what I can say is that be honest, be yourself, and disclose as much as you feel comfortable. You will have the opportunity in the future to revisit some topics and add more information if you feel you need to do that.
Okay, great. And what about homework? I feel like that's another thing that people get a little nervous about with starting therapy. How much work is this going to be? Is there homework? Or, does everything kind of happen within the session itself? Or does it, depend?
I would say it depends. It depends vastly depending on the therapist and also the specific type of therapy that you're doing. I personally utilize a decent amount of homework. I do a lot of cognitive behavioral therapy, acceptance and commitment therapy, and other types of therapies that are very skills-based. And I do utilize homework because I find that it can be really helpful to make the progress that you're making in sessions really stick. And it also gives you an opportunity to sort of practice those skills. That being said, it's not the kind of homework that you had to do in elementary school that was boring and tedious and frustrating. It tends to be meaningful. It tends to be aligned with what you're looking for, what's important to you in your life. Sometimes it's even fun. Sometimes I'll tell people, hey, for your homework, I want you to go see this new movie that you've been dying to see that just came out on Friday. So it depends on what it is. What I will say is, also, if you're having concerns about this, and if you're saying, A, I feel intimidated by this, B, I've had a difficult time maintaining the ability to sustain homework in the past, C, like, what the heck is the point of doing this homework? Share your concerns and your questions with your therapist. It shouldn't feel suffocating. It shouldn't feel restrictive. It should really open you up to new opportunities. And oftentimes the homework will either come in slowly or it will taper down over the course of your work. So I'd say it depends, but there are some types of therapy out there that don't utilize a lot of homework. So it's really a wonderful question for you to ask a prospective therapist when you're first meeting with them.
Yeah, and I'm assuming that, you can be honest if you forgot to do your homework or just didn't feel like it.
Yes.
Great. Well, that, brings me to other kind of misconceptions that people probably have about like what happens in therapy. What does the process look like? What should I be expecting? So, what are some of the biggest misconceptions that you hear? Dr. Gaddi, we'll start with you.
Yeah, so I think that there's a lot of misconceptions about therapy. One of them is that we already talked a little bit about that, and is that you have to have a specific problem, or that your problem have to be really severe to go to therapy. When in reality, it's always a good time to go to therapy. Sometimes people also mention that because you're going to therapy, you're being weak. And I always talk to my patients about that. I actually feel that if you're going to somebody to talk to your problems and stressful things, it's actually a sign of strength. You have to be brave. You have to have some courage to go to somebody and say, hey, I need help. It's also a sign that you're trying to be proactive and less reactive. You want to get, you're preparing for stressors or different things, changes in your life. I also think that people tend to think that the therapist is going to tell you what to do. And in reality, what we do is that together we work to find out how do you think you should navigate these situations?
Yeah, those are great. I've definitely heard and probably thought some of those myself. What about you, Dr. Stern?
I would totally agree with everything that Dr. Gaddi is saying. I'd say one of the other big ones that I hear is people will often say, well, once I start therapy, am I going to have to be in therapy forever? And for a lot of people, that's super daunting because they think that once they sign up, they're making this lifelong commitment that's going to be very overwhelming for them to have to commit to. And the answer is absolutely not across the board. There are some people who do stay in and out of therapy throughout the majority of their lives for various different reasons. And so I don't want to make a blanket statement here. That being said, for a lot of people, therapy can be really short term. It also can come in waves. So you might do a course of therapy, then take a break, use the opportunity to practice your skills, then come back for what I like to call booster sessions. So it really sort of depends on what your needs are. And so you definitely don't have to make a lifelong commitment. You also don't have to make a lifelong commitment to your therapist. The first one that you choose or the second one you choose, if they're not jiving for you, if you've gotten everything that you need out of them, if for some reason you feel uncomfortable or you feel like they can no longer help you, you are more than welcome to, not just welcome to, but encouraged to consider if there's a different option out there that maybe makes you feel more comfortable and will accelerate your growth. So I'd say those are some of the other big ones that I would mention.
Yeah, that's a great one. So that you're allowed to break up with your therapist if
Yeah.
it's not working, it sounds like.
Yep.
And you talked about fit too. Like, I think that that's something that people struggle with when they are first starting out. They might go through a few sessions or even a few months and think, I don't know that this is working, or I don't know that this is the right fit for me. What would you say to people that are kind of in that situation? They're just not sure that this is right. Dr. Gaddi, we'll start with you.
Yeah. So the first thing to remember is that it may take some time. So definitely, I don't want you to make this decision after 1 or 2 sessions because it may take some time. But also, I think that is ideally you address this with your therapist. I think that most of the therapists, healthcare providers, will really welcome those kind of conversations. What can I do to make you feel better? Is there something that we can change? I think that also if you feel you're in a situation, you can actually talk to your therapist if your goals or the situation have changed. If something is not working, ideally that's a conversation that you can have during the session with your therapist for sure.
Yeah, that makes sense. Dr. Stern, anything to add there about, I guess maybe even just like identifying if like what the fit is supposed to feel like, maybe.
Yeah, I think part of what's so challenging about this fit question is that I kind of see it in phases sometimes with folks. So the first stage, it's almost a little bit like dating or starting a new relationship. The first stage is, do I feel comfortable with this person? Do I feel comfortable with this therapist? Are they making it a welcoming space? Do I feel not judged by them? Do I feel safe enough with this new stranger to be able to share things with them? That's kind of phase one. And then phase 1.5 to 2 is, can they help me? Even if they're a wonderful person and I feel really safe and comfortable, do they have the potential expertise that I personally need with my own struggles? And so what you can do is sort of determine, does this person seem to know how they can help me? And that's something you can actually ask at the initial phone consultation. And you can say, what is your experience in working with this? And I think we'll talk a little bit more about this on the panel, but what is your experience in working with this and what types of things would you be able to do for me? And then assess that. And I would say, just like Dr. Gaddi said before, sometimes it takes a little bit of time. So unless you feel really uncomfortable or unsafe with a therapist, you do want to give it a couple of sessions to test it out. Because what might also be happening is sometimes you might feel a little bit guarded based on previous experiences you had, either with a previous therapist that you didn't jive with or other relationships in your life. And you might want the opportunity to sort of explore, am I giving this new therapist a good chance to be able to help me?
Yeah, that's a great point because I think we want, especially if you're just starting therapy, like you want immediate results. You want to immediately feel better. And so I know that I have had that situation where you're like, if I don't immediately feel better when I just left that session, it must not be, for me, or this must not be the fit. So I think that's a helpful reminder to just trust the process a little bit.
And if I can add something there that I think is really important is that therapy doesn't start the moment that you leave the office or that you close your laptop. And I feel like sometimes people feel that when they go to therapy, they are just kind of venting and there's nothing more. So that can feel kind of, they're a little bit stuck. There's nothing wrong with those sessions though. We always need one of those sessions that you just want to vent and, you want someone to listen that everything that is in your mind. But if you feel like there's nothing more and the progress is minimal, then definitely probably it's not the right fit, or we should address that in session.
Mm-hmm.
Yeah, and that actually kind of brings up another question of like the cadence of therapy. I think, and this might depend also on like the type of therapy that you are going to, but on average, I guess, how often would you say people tend to go to therapy? And we talked about this a bit, but like, and how long? What should people kind of expect when they're first starting out? This is like a weekly thing, a twice a week thing, an everyday thing. What does this usually look like?
I would say on average, it tends to be weekly, but with caveats. It also does depend on the type of therapy that you're doing. So, certain types of therapy, like DBT, for instance, or in some cases, psychoanalysis, you might be seen twice a week. Or in other circumstances, there might actually be the opportunity to be seen every other week if that's all that you can do financially. So, there is no specific one size fits all for this. Again, a lot of it depends on both the type of therapy that you're doing as well as the whatever you're capable of delivering at that point. That being said, your therapist will likely make a recommendation of, this is how frequently I tend to work with someone, especially at the beginning or during an active phase. And so you can have a conversation with them about their recommendations. And what I would say too is oftentimes once, especially in the way that I practice, is once someone has consistently demonstrated progress and feels like they're doing well, we might start to titrate down sessions, maybe meet every other week or once a month or as needed. And so that is totally normal. And oftentimes that's an awesome, awesome sign if you and your therapist have arrived at that place where that feels like the appropriate fit for you.
Got it. So it does sound like this is like an ongoing conversation, that you're not just,
Mm-hmm.
set up with like, see every Tuesday and that's it.
Mm-hmm.
Correct. And I always like to tell my patients that this is not a quick fix. Even when we talk about short-term therapy, we're talking about 12, maybe 20 weeks. So it's a lot of work. So therapy is a lot of work, a lot of reflection, a lot of growth, but it does work. So you have to be a little bit patient, but definitely there's some patients that start twice per week, and eventually they decrease it by weekly, and then bi-weekly, and then maybe even monthly.
Okay, that makes sense. I feel like now we're getting into, again, a lot of these like misconceptions and myths that people have about what goes on in therapy. So let's say for the people who have never tried it and they're considering it maybe for the first time after watching this panel, or maybe they've been in the back of their mind thinking this is maybe something for me. What advice do you have for people who are in that boat? They are not sure if they should kind of get started or not. Dr. Stern, let's start with you.
Okay. I would say go ahead and just start doing a little bit of research. I think you might find that it brings up different things for you. So, for instance, you might find that by starting to do research, you maybe feel a sense of relief of like, okay, I'm like finally ready to do this. And I feel ready to do, whatever the next steps are after the research part. You might also start to feel overwhelmed. And if you're feeling overwhelmed, that might be a sign that maybe you want to ask for some help from someone. Maybe there's a trusted person in your life that you can say, hey, can you sit with me and help me process all this information of all the therapists that are out there? And so by taking that first step, it can kind of help you figure out what is the next step after that, and with what movement can I move on to the next step. But I would say, again, kind of like we said before, if you're starting to percolate, if that idea is coming to you and you're like, I think I'm ready, you can just do that in a piecemeal way. And I would say just take it one step at a time. So again, you start off by populating a list of different people that look good to you. Then you can reach out to a couple of them at a time. Then maybe do 1 or 2 phone consultations. So I think oftentimes people think that once they decide they're going to do therapy, they have to do everything all at once and they have to have a session within 3 days. But that's not necessarily the case. You can do it one piece at a time in a way that doesn't feel so daunting.
Yeah, that makes it seem a lot less scary. Dr. Gaddi, anything that you would add around people that are, just kind of contemplating this? They've never tried it before and have no idea what to expect. And maybe this conversation has them feeling, a little bit more anxious about like, oh, I don't know if I'm ready for all those feelings and talking.
Yeah, I think that this is particularly helpful if you know about somebody, a friend, a relative, a loved one that is doing therapy. It would be a really good conversation to have. Like, how do you feel about it? How does it go? And I think that probably will make you feel less anxious about it. But I also will say that be yourself. You can schedule, when you're in doubt, just schedule a first session with the therapist. Go there, meet with them. Be yourself. There's not a right way to talk in therapy. Try to be yourself and be honest, and then you can decide if this is the right fit for you.
So you're saying that we shouldn't all be in competition to be our therapist's favorite person or favorite client? Because I think we all do that. Well, what about advice for the people who maybe have tried therapy in the past and they, for whatever reason, thought it was just not for them? Do you feel like there are some people that are just like, it's not for them? It might not be what you need, or would you suggest people give it another shot with maybe somebody else?
Yeah, I would recommend to actually reflect on what was going on at that time. What you didn't like, what didn't work for you. And keep in mind that there are different types of therapies, modalities, and every single therapist is different. I also think that timing is key. And if at this time you're thinking about that, you're questioning yourself on where it didn't work, was it the right thing for me or not, it's probably because you're ready again to try it. Probably you will benefit from that process or to start the process again.
Yeah, that makes sense. Dr. Stern, anything you would add for people who feel like, no, I'm just not a therapy person?
I would say that I would be hard pressed to find someone that really truly couldn't benefit from therapy. And so if you think that you are one of those folks, I'm sure you're a unicorn in other ways. However, I don't think that this is the potentially the way. I think what ends up happening is that, like Dr. Gaddi said, there are a lot of different reasons for why you may have felt that therapy was not right for you or that therapy didn't go well. And taking a step back and sort of reevaluating, how can I do things differently this time, or what is different about this space and time can be really helpful. Something that I love that was done in popular press, or in media rather, was, for anyone who watches Ted Lasso, I'm not going to spoil anything, but there was a storyline around this exact thing of someone who didn't have a great therapy experience, tried to write therapy off, and then revisited it at a later time and found that it was really helpful for them in a different capacity with a different mindset. And so you really never know, and I would encourage you to reconsider it if you're starting to think that maybe it could be helpful for you.
Yes, I want more Ted Lasso and that storyline because yes, I feel like such a good way to just kind of destigmatize, a lot of our thoughts and like the narrative around going to therapy and that it has to be that there's something wrong with you. Um, is there anything else that either of you want people to know about starting therapy or being in therapy that you feel like maybe people get wrong or yeah, just any of those like kind of lingering stigmas maybe out there?
I would probably add that therapy session is about you. It's your time, and you can use it, or you can ask your therapist to use it as you think it will be most beneficial for you. Um, like we say, there's never a wrong time to go to therapy. Even if you're already established with your therapist and there's a day that you don't know what to talk about, sometimes those are the best sessions that you can have. But if you're also having like a crisis and you feel like you have too much to talk about it, it's also a good time to go to therapy.
Yes, I always feel like if you don't have anything to talk about in therapy, that ends up being the session where like you uncover something else that you didn't even know that you wanted to talk about.
And you can feel free to say that to your therapist. Today I don't know if I have something in specific to talk about, and that can be actually open the conversation to new things, new goals for you.
That's great. It's like a challenge.
Right.
Dr. Stern, anything that you would add for people who yeah, like you, something maybe that you wish that clients knew?
Oh my goodness. Please stop apologizing for crying in session. The amount of beautiful souls who apologize to me because they're crying in session and they feel overwhelmed. I always joke with people. I say, if you can't cry in therapy, where can you cry? And all of this to say that this is your opportunity to be authentic, to be raw, to be vulnerable. And short of being disrespectful to your therapist, pretty much anything goes in therapy. And so, really, this is your opportunity to just be yourself because this is your space. And oftentimes, some of these conversations can really lead to very fruitful discoveries or opportunities. And so, it's a really nice way for you to explore what's coming up for me. If you're apologizing for crying and you're feeling some sort of way about it, like that might be a golden piece for you to really explore with your therapist to understand what's going on for me that I'm feeling that need to apologize for this thing that feels so natural to the space that I'm in right now.
That's such a good one. And I feel like that combined with this session is your own is such an important reminder for people who, maybe have like people pleasing tendencies and want to go right in with, well, how are you doing? It's like
Yeah.
this is your session. Well, we have some great questions coming in too. Thanks everyone for contributing them. Please feel free to keep putting them in the question box, but I want to switch over to some of these. We talked about this before of like the concept of breaking up with your therapist. And someone asked, how do you recommend breaking up with your therapist, especially if you feel like your sessions maybe are not very productive? I don't know if either of you have thoughts on the best way to do that.
Yes, I feel like it's a kind of anxiety provoking conversation to have, but it's completely normal. We do that every single day. Just keep that in mind that this is what we do every single day, multiple times per day. So if you feel like right now you're not getting you're not noticing any progress, or that you don't need therapy anymore, it's a good conversation to have. You can also approach it kind of gradually. You can tell your therapist that you want to do it less often, maybe every other week, monthly. And I would say, maybe this is an unpopular opinion, but if you feel like it wasn't the right experience, or you felt uncomfortable, it will be completely okay to go ask your therapist, and just don't schedule the next appointment, and and that's it. It's not ideal, but it's okay.
Ghosting sometimes happens, and I get it. You guys used the dating analogy before. Like, I feel like sometimes, and Dr. Stern, you said this too, of like disrespect and respect happening in sessions. I'm assuming there are cases where you guys would suggest, like, yeah, you don't need to, you don't really owe them anything other than like letting them know you're not going to be at the next session. Dr. Stern, any other advice for people who are trying to either break up with their therapist or know if it is like time to?
I would say, unless you're feeling really uncomfortable with your therapist or they have been really resistant to conversations around what I'm about to say, you'd want to actually, I think, ideally have a conversation with them first. So if you think that there's potentially an opportunity to turn the therapy into something else, to revisit things that you haven't really achieved that you've wanted to explore new tools or conversations, to go to your therapist and say, I think we've hit a roadblock. I don't think I'm getting what I need out of this. Can we talk about that? And see how they respond. Sometimes that can be a very valuable conversation that can actually breathe new life into the therapy and also give you an opportunity to have really meaningful, almost repairs with your therapist if it feels like that's necessary. However, if you've had that conversation or if you've tried that conversation and your therapist either shuts you down or they try to be open to it but don't seem to be able to give you the juice that you need, then you can go back to them and say, appreciate your time, if that's appropriate. And I just don't think this is the right fit, or I'm going to potentially pursue something else. And so you can have that conversation with them in that way. But again, this is your time and your space. You are the consumer. And so if you are not getting the service that you need out of this, make sure that you honor that. The one caveat I would have to this conversation, and I'm going to potentially make people a smidgen uncomfortable with this, is sometimes you might want to flee from your therapist because they're giving you recommendations that might scare you. Now, unless they're telling you to do something that's harmful to you or in some ways is going to put you in a bad position, if they're potentially encouraging you to consider things that are maybe a little bit uncomfy and you're feeling the urge to flee, you might want to think about what that's about. Like, what's happening for you in that moment? Is this something that actually would be beneficial for me to explore with my therapist? Because sometimes there's something deeply therapeutic about that conversation, about that exploration. But sometimes the therapist is going to give you recommendations that are just not going to be helpful, and you can just bid adieu.
Yeah. Yeah, I bet just like trying to toe that line between like, is this truly just uncomfortable, but I get it, or is this like fully off base, kind of not right for me? We have another question also that kind of along the same lines of if you are thinking it's around the time for you to end therapy or stop seeing this therapist or kind of taper off, how do you separate from like that need, if the routine of it all? So this question is the kind of need to be with your therapist. What if it gets into like a routine that's hard to break? I'm assuming maybe they're talking about like you kind of rely on it. Maybe you're seeing it simply as a routine and not necessarily as productive as before. Any tips on dealing with that?
I think that also the type of therapy or the therapy or modality may change over time. Sometimes people will start doing another more like supportive or maintenance therapy, and maybe the goals have changed. So you can talk to your therapist about that. You can probably continue more like long term, maybe less often. Sometimes I will see that. You will use a specific a modality or approach in therapy, and the patient feels ready for another type of therapy, and that is completely okay. And if the therapist doesn't feel comfortable with that type of therapy, we will provide the resources and guide you to the right provider.
That makes sense. We have a question here around, we talked about this, like the venting kind of session in therapy, and you're getting so many great insights and so much advice, and you don't always remember all of it. So this question is, when I go to my therapy sessions, I vent a lot. My therapist gives me some advice. I think it helps me, but with all the emotions that you have in the session, I feel that afterwards, I don't always remember everything. So any tips for like really digesting what's going on in therapy? I've definitely had this too, where like you learn a bunch of coping skills and then they're completely gone the next day.
I think there are a couple of remedies to this. One is, if you're learning concrete skills, you can actually ask your therapist if they have any handouts or worksheets that they can send you. Anybody who knows me knows that I love worksheets, some of which I've co-created with Wondermind, actually. And so that's an opportunity for you to sort of digest some of this information from your therapist's own voice or from their toolbox. So I think that's one opportunity. Another opportunity is you can actually journal right after your therapy when things are still fresh in your mind. You could even just do a brain dump. It doesn't have to be in any organizational modality. It could be just the different things that are coming to your mind as you're leaving your therapy session. I think the third option is you can actually ask your therapist and say, hey, is there a productive way for me to actually take notes in session? You don't want to be so focused on your notes that you're not present in your conversation with your therapist. You don't want this to feel like school per se, but if you can use a fun notebook or something like that, a journal, to help you process the information that you're processing in session, that might be a meaningful opportunity for you.
In your practice? Oh, we might have frozen you. Any other thoughts around like helping someone to kind of retain the information or put it into practice after the session ends?
Yeah, I think that I also love when my patients bring notes. Like, even those notes that happen after the session or where they try to practice and they are like, oh my God, I was thinking about you and this happened. I took notes. I think that that's really valuable because we're applying those skills to a specific events, and that makes it easier to remember. But I will say that I agree with everything that Dr. Stern say. I do think that there's ways to take notes, and some people, they are not really good about writing on paper, but those are the few occasions that it's okay, grab your phone and open the note app and you can take a few notes so you don't forget about this.
Yes, that's a great one. I love this question we just got too. Is there any way to find or filter out therapists or any other mental health care providers who might be more culturally sensitive to your specific culture or background? So we talked about like where to start looking for therapists, but if you are looking, specifically for someone with cultural competency or like shares your identity in some way, what are some tips that you have for that?
I do think that one of the most valuable tools that we have there are the directories like Psychology Today. In particular, that I mentioned that one because you can apply filters for location, culture, and a lot of the providers are there, including psychiatrists and therapists. We disclose a lot of more like personal information. For example, in my case, I mentioned there that I'm part of the LGBTQ plus community. So you can filter that and you can find people that speak your language, that they have the same cultural background than you, or they belong to a minority group like you.
Perfect. Yeah, I've also, what's the website? Inclusive Therapists. I feel like has good filters as well. Dr. Stern, any other tips you would have there?
I think the only other thing I would say is, this is what I was referring to earlier on today's panel, is this is where you can also visit some nonprofit organizations that might align with you. So like I mentioned, Therapy for Black Girls or the Trevor Project or whatever it might be, different organizations that might align with the specialty that you need based on who you are as a human. That can be really helpful as well. And if they don't have the right resources for you, sometimes they can direct you to the place that might have the right resources for you. So that might be an opportunity as well. But I agree, the directories with the filters can give you a good starting point. And what you'll want to do is read the biography that your therapist or the therapist has written, because that can give you sometimes a really good clue into who they are as a human and how they think about the way that they conceptualize the people that they work with.
Yeah, definitely. I feel like going to a therapist's website can give you so much of an idea of their vibe, of course, and of their specialties, and give you at least a good starting point if you're doing your research.
And I can also add that if you have insurance, you can also talk to them. It happens really often in my case, finding providers that speak Spanish. That is actually the insurance that will contact me for a patient in particular, a member of their insurance that is looking for someone that speaks Spanish or is in the area. So you can also talk to them, and some insurance companies will help you through that process.
That's super helpful. Well, I wish we had more time, but thank you all so much for joining us for this panel. Thank you, Dr. Stern. Thank you, Dr. Gaddi. This was so helpful. We do have one more session left today. We have Rest and Reflect starting in 15 minutes. So be sure to check that out. And don't forget to subscribe to the Wondermind newsletter. We'll send you replays from today and tons more mental fitness tips. So thank you.